Hello, my name is Dr. Amit Atrey. I'm an orthopedic surgeon and I specialize in hip and knee replacement surgery. So already in this series, you've learned that there are different ways to fix the implant, like cemented or uncemented, and different bearing types like ceramic and metal and polyethylene. Now we'll review various surgical techniques and approaches. And just like the implants, there are different ways for your surgeon to get into the hip joint. We call this the surgical approach to the hip. One option is to go through the front, called the anterior approach. Or you can go through the side, called the lateral approach. Or through the back, the posterior approach. All approaches have their good points and their issues. I recommend you choose a surgeon who you feel confident with, who has a good reputation, and who is comfortable with what they do. It's like the phrase, if you're in a battle, spend time choosing a good archer, not the arrows that they use. All approaches can have similar outcomes, but it's your surgeon with their experience, skill, and the support that they provide after the operation that ultimately results in a good outcome. In this next section, we highlight some of the benefits and risks of each approach so you have an overall idea before you speak to your surgeon. The anterior approach goes through the front of the hip. The approach is becoming popular because some evidence shows the recovery in the first 6 weeks is the fastest. This is because there is no muscle cutting. It also allows the surgeon to use an X-ray machine in the operating room so your surgeon can see things like the position of the implants before they finish. There are downsides of this approach as well. There's a potential increased risk of fracturing the bones while putting in the implant. There is also a slightly higher risk of implants changing position or subsiding or sinking a few years later. There can be a 1 in 5 risk of damage to a nerve that runs down the front of the leg. This nerve is called the lateral cutaneous nerve of thigh. This could mean a temporary or permanent numbness down the side of the leg. Rarely, it can lead to pain. And finally, especially in people who are overweight and obese, there may be a higher rate of infection. The posterior approach goes through the back. It doesn't cut any muscles either on the way to the joint, which makes recovery great. I use the posterior approach in my practice. In fact, I actually use a minimally invasive, small incision, sometimes called a star approach to the hip. Even through a small incision, I get a great view of the socket and the thigh part of the bone. And because I don't cut any muscles, you shouldn't end up with a limp. The downsides of the posterior approach is that most studies show there's a higher rate of dislocation. That's when the ball falls out of the socket. It's still very low and it should be much less than 1 to 2%. Additionally, there's a large nerve that runs down the side of the leg called the sciatic nerve, which can be damaged during operation. This can lead to temporary or more permanent loss of sensation in the lower leg and sometimes the inability to lift the foot up. This is called a foot drop, but an injury to the sciatic nerve is also so rare. The lateral approach is the most traditional approach to the hip. It's the most commonly used by surgeons who want to keep dislocation rates low. A dislocation, again, is when the ball falls out of the socket, and of course, this can be a real problem. Almost every study has shown that the lateral approach has the lowest rates of dislocation. Through this approach, your surgeon gets a great view for positioning the thigh implant. And after all, it's important your surgeon can see what they're doing. The major downside is that the lateral approach has to go through 2 of the gluteal muscles, the glutes. These are the muscles that help your leg go outwards and it stabilizes your pelvis. If the repair isn't perfect, you can be left with a swinging waddle when you walk, or even persistent pain. But again, if your surgeon has been using this approach for a long time and is experienced and skilled, chances are that they'll have an excellent technique to repair the muscles and the tendons. This lady has perfectly working hip replacements and the hips are in really great position. As you now know, we can achieve this result through different ways and different approaches. The important thing is your surgeon is competent and comfortable in their approach. Joint recovery is your daily, at-home, physio-guided rehab program. You'll get 30 days of videos, one for every day of your first month after surgery, to get you to be your best self as soon as possible.